Hi, baby. Hi guys, welcome back to my channel. My name is Anna. I'm a clinical psychology doctorate student and I make videos about real life applications to psychology. In this video, we're going to be talking about high functioning disorders. First of all, what does it mean to be high functioning? So in order to have a diagnosis, you have to have symptoms that are clinically elevated. This means not just a little high, but past the threshold of where it might be considered normal. So everything is on a spectrum, and think about if you've learned about bell-shaped U-curves, past a certain point, it's not considered normal anymore. It's considered pathological, and it's not in line with what the majority of the population is experiencing. So clinically elevated usually means significant distress, so this is subjective distress, and or impairment in functioning. Impairment in functioning could be social, like with your friends, family, or romantic partners. It could be academic, like not showing up to school or getting bad grades, failing classes, getting in trouble with teachers. It could be occupational, like not doing your work, getting in trouble with coworkers, getting fired. And it can also be in terms of adaptive functioning, like your day-to-day routine. How well can you take care of yourself? Do you shower? Do you get up every day? Do you cook for yourself? Are you able to take care of yourself independently? So if you don't have impaired functioning, meaning you're high functioning, and you have a diagnosis, what does that mean for you? Probably means that you have a high level of subjective distress. And this is kind of tricky because, of course, everyone experiences distress differently. People have different distress tolerances, and we can't really know how much distress another person is in because they're experiencing it internally. So let me give you a couple examples of high-functioning disorders and how they might look so that you kind of get a sense of what I'm talking about. Let's think about high-functioning depression. How might that look? You might still have some difficulties with insomnia or over or under eating, maybe oversleeping, some feelings of hopelessness, sadness, tearfulness, etc. You're probably not spending the whole day unable to get out of bed, which is how a lot of people with depression feel. Like they don't even have the energy to get out of bed. Someone who's high functioning probably doesn't have that loss of energy completely, or maybe they're still fatigued, but they're able to push through it somehow. They're still able to get up and do things, take care of themselves, go to work, go to school, have relationships with people, see their friends, and you might not guess that they're actually experiencing a great deal of depression. So an example is someone with chronic depression once told me that he always felt like he had to be the life of the party, and he could never just wallow in his sadness. And that's an example of high-functioning depression, someone who's seen as the life of the party, but deep down they're really upset, they're in a great deal of distress. Someone with high-functioning depression might get comments from people like, I never would have guessed, or you're not really depressed, or you're just saying that for attention, or this is just a phase for you. Because the distress is not visibly apparent to them because people mask it well. Another example, let's talk about high-functioning psychopathy. One of my subscribers actually has requested this because she herself has been dealing with this. So let's just talk about how high-functioning psychopathy could look. Someone with high-functioning psychopathy might still struggle with lack of remorse or guilt or empathy. They might occasionally make some reckless or impulsive decisions. They might be overconfident. They might at times feel the urge to be manipulative or deceptive. For psychopathy, distress is actually not a criterion because antisocial personality disorder, that's the diagnosis for psychopathy currently, rarely ever causes the person themselves the distress. It's usually the consequences for other people around them. So usually when there is distress to the person with psychopathy, it's because the consequences of their actions backfired on them, not because they did something to themselves that hurt necessarily. So the criteria for antisocial personality disorder really relies on, functioning being impaired rather than feeling subjective distress, which by definition means that someone cannot technically be high functioning while having psychopathy. Psychopathy is rarely ever diagnosed if it's not full-fledged because of the stigma that that label can carry. Because it is such a serious diagnosis, not a lot of clinicians are really willing to diagnose just tendencies of psychopathy. So when we talk about high-functioning psychopathy, what we're really talking about is just psychopathic tendencies rather than the full-fledged disorder. People who probably do not meet the full criteria, but maybe just kind of have that personality leaning towards psychopathy. But don't let that mean that just because you don't technically meet the criteria or the symptoms for a disorder, that your symptoms or your experience do not matter. Of course not. With mental health, pretty much everything is on a spectrum, and at some point we have to decide, is this pathological or not? But that doesn't mean that if you don't reach that point that you can't experience distress or that your experiences don't matter. It's just about how far along a spectrum you lie. It's suspected that up to 10% of the world's CEOs have some low-level psychopathy. Because if you think about it, it's adaptive to a certain degree to be able to make those cold, hard decisions and not be swayed by other people's emotions, to not second guess yourself, to not be afraid to take chances, to feel confident, to know how to persuade people. All these things can be very adaptive. So when we are talking about high-functioning psychopathy, we're really talking about that rather than full-fledged disorder. Let's also give the example of high-functioning borderline personality disorder. High-functioning BPD can often be misdiagnosed as depression, anxiety, a trauma response. Oftentimes, it's a bunch of these diagnoses lumped together because the correct diagnosis hasn't even been considered, because people don't really think about personality disorders unless it's something that they're passionate about. Unfortunately, a lot of clinicians believe that personality disorders are extremely rare and that they'll never see them in their career. They think of them as these mythical diagnoses that don't have to be considered, when in reality, someone could have tendencies of a personality disorder, absolutely, and be high functioning and still technically meet the criteria for it. So high functioning BPD might be characterized by high conflict relationships that aren't completely explosive, switching between idealizing and devaluing people really quickly, serious internal dysregulation, so emotionally feeling very distressed, impulsive and self-destructive behavior, but not to a degree where it causes impairment in functioning. Like you're able to hold a job, you're able to do well in school, you're able to have friendships even if they are fraught with a lot of conflict. Sometimes people call it quiet borderline because there isn't that explosiveness, you don't see that impulsive, reckless distress very visibly because people sometimes hold it inside themselves. Especially, I kind of think of quiet borderline as a mix between anxiety and borderline personality disorder. But the distress is still there internally. People with quiet borderline still experience high amounts of distress in their own being, but you might not visibly see it. So what are the unique issues that someone with a high functioning disorder might have to face? There's a pro of it. Of course, you're able to go on living your life, you're able to go on functioning. That's a very good thing. Even if you do have a disorder, you're going to want to be high functioning rather than low functioning, even if you have a disorder. However, a really big con is that your distress is invisible. It's not readily apparent. And people might invalidate you because your distress is not readily apparent to them. They might say, no, you're just doing it for attention, or you're not really experiencing this, or you're not really in pain, or I know what anxiety looks like and it isn't this. Another con of dealing with a high functioning disorder is you can get a misdiagnosis or a lack of diagnosis by clinicians. So like I mentioned, BPD can often be misdiagnosed with different things. If people don't see that it's not the full-fledged personality disorder, they might think, oh no, I don't think that it's this. And another con is you might not ask for the help that you need until the very last moment. Because you are so high functioning, you can't keep up with your life. So by the time you go to therapy, it's because you're in so much distress that you just can't handle it anymore. No one wants to go to therapy when their life is in order, but they have to once their life is falling apart. So if things start to fall apart faster, in a sense that's better because you get help earlier on. So my advice, if you are someone with a high functioning disorder, communicate your distress to people. Make the unknown known to people. If you are experiencing a lot of distress, communicate that with them. Try to educate them about how mental illness doesn't necessarily mean that you are low functioning. And also be prepared to be invalidated. Have people on your side who are sensitive to this issue. Maybe don't bring it up to people who you know are going to invalidate you. But know deep down that your distress is important and you matter, and you deserve to have that distress heard and cured. And if you care about someone that has a high functioning disorder, don't assume that they're lying. Don't assume that they're exaggerating or doing it for attention or anything like that. Give them the benefit of the doubt. Read up on the disorder and see what symptoms they meet. Ask them about their experience. Be there for them, not because they do or don't meet the criteria for a disorder, but because they're in pain. I hope this was helpful for anyone wondering about high functioning disorders. If you're someone who's experiencing a high functioning disorder, I would love to hear your experience and how it looks for you down in the comments below. Don't forget to hit like and subscribe, and I'll see you soon.